Hello and welcome everyone to today's webinar on the Florida HIE's Encounter Notification Service for Skilled Nursing Facilities. We're super excited to have you here today, learning a little bit more about how our Encounter Notification Service can benefit and assist skilled nursing facilities in treating patients here in the state of Florida. Today we have a special guest speaker, Mr. Aaron Parsons. He is a manager with Audacious Inquiry, and he is an expert at the Florida's Encounter Notification Service, and he's going to be sharing some information specific to skilled nursing facilities, but this information is really fairly broad and can be applied to other types of facilities, but just a specific interest for skilled nursing facilities today. Welcome, Aaron.
Thanks, Pam. Thanks for having me on. I'm looking forward to the conversation.
So do you want to go ahead and I can either turn over the slides to you or I can move them forward for you.
If you want to do the slides, then we can just jump right in.
Okay, great. Let's get started.
All right, thanks. And thank you everyone for taking the time to join us this morning to learn a little bit about what we're doing with the Florida Health Information Exchange and the Encounter Notification Service. So I want to start here at the beginning just kind of with the big picture and the overview of the work that we're doing. So the Florida Health Information Exchange is a state-backed network that is governed by the Agency for Healthcare Administration. We offer one easy connection for skilled nursing facilities to exchange data with hundreds of hospitals and with every major accountable care organization in the state of Florida. All the data that is exchanged over the network is patient authorized exchange, and there is funding available to Medicaid providers, which is going to cover most SNFs, to cover their initial vendor fees. And so the rest of our conversation this morning is just diving into the details about ENS and how SNFs can connect and benefit and how their patients can benefit. So the data that we exchange, ENS works by providing real-time notice of healthcare encounters. And the data that we would be exchanging for skilled nursing facilities can benefit them in a number of ways. One is by notifying skilled nursing facilities anytime a recently discharged patient receives inpatient or emergency care at a network hospital. We can also inform you of any known affiliations that a patient has with an accountable care organization, a hospital, PCP, or health plan on admit. So we can tell you on admit who else is involved in that patient's care. And we can also share your admit and discharge information with other network participants like ACOs and hospitals. And we've heard from quite a few skilled nursing facilities that they're currently doing a lot of this manually, that the ACOs in particular, but also hospitals and PCPs are very interested in knowing when their patients are at your facility. And we provide an easy way to kind of automate the sharing of that information to simplify things for your facility and for your organization. So ENS works by routing real-time notice of patient healthcare encounters. And so on one side of the network, we have our data senders, and that includes hospitals and post-acute care facilities like skilled nursing facilities, home health, and hospice. And on the other side of the network, we have data recipients, and that includes PCPs, accountable care organizations, skilled nursing facilities are both senders and receivers. Health plans are also recipients of data. And on the sender side, we have most of the hospitals in Florida. We have over 225 hospitals here in state that are connected and sending data live. That covers 95% of acute care hospitals in the state already connected, and 89% of inpatient rehabilitation hospitals also connected. These are real-time automated data feeds, so it doesn't require any manual intervention by staff when there's an admit or a discharge or to push us a file at the end of the day. This is all built on existing workflows. So we set up the interface and the data flows, and we're able to pull that data in and compare it to subscriber lists. You can see our full list of participating organizations online. So this isn't held privately or anything. The list is available to the public, and you can see that on our website at florida-hie.net. In addition to connected hospitals, we're also actively working to onboard skilled nursing facilities. So we really started this effort to connect post-acute and skilled nursing in particular in 2019. And so far we have connected 120 skilled nursing facilities live on the network, the vast majority of which are not only sending data, but they're also receiving data back. So they know when their patients go to the hospital, they know on admit who else is involved. On the other side of the network, we have our data recipients, and that includes 12 large health systems, primarily in Central and South Florida, that together have over 100 hospitals, 25 accountable care organizations, Medicare Shared Savings Program, ACOs, that are part of the network, and these are all of the major ACOs across the state of Florida. We also have 80 provider organizations, primarily primary care, but also some specialty providers as well. 85 skilled nursing facilities are currently receiving data through the network. So they discharge a patient, the patient goes to the hospital, and we're letting them know about that in real time. And that can be particularly useful right now with everything that's going on with the pandemic, knowing that your patients have, a patient you discharged yesterday has now shown up at the hospital with symptoms consistent with coronavirus. That can really assist with mitigation strategies for skilled nursing facilities that are receiving these alerts. And we also have a large number of health plans. All of the Medicaid plans are connected, along with a number of commercial and MA plans. Our total coverage in Florida, we cover 13 million subscribed to lives. So if any one of those individuals goes to the hospital or goes to a post-acute facility, we're alerting on those IDs. And we're currently delivering about 1.7 million notifications every month. So this has been up and running for about 5 years now, since 2015, and we have really robust participation. We currently have 150 skilled nursing facilities that are signed up to participate in ENS. From the map, these are statewide from Pensacola all the way down to Miami. 120 of those are live and exchanging data now, and the other 30 are in progress. So the process for getting connected is really simple, especially for those skilled nursing facilities that are clients of Point Click Care, which is the major EMR vendor in the post-acute space. We've already completed the technical work to connect ENS to Point Click Care. And so if you are a Point Click Care client, all you have to do is ask them to opt into data sharing with the Florida HIE, and they'll enable your connection. If you work with another EHR vendor, because there are a number of others in this space, all you have to do is, after you've started the onboarding process, connect us with your EHR vendor or IT vendor, and we can work out the process with them to get you connected and get the data flowing. So still fairly straightforward, or even if you don't have an EHR, we can still have those conversations about how to get the data moving. In addition, there is funding available, and Pam is here on the call and emceeing the call and can answer any questions specific to the funding. But there is funding available for Medicaid providers to cover your initial connectivity fees. So if your IT vendor charges any fees to set up an outbound data feed, those fees would be covered for the first year. We also charge a small fee to route data back to your organization. And so one of the steps in the onboarding process is to reach out to ACA and confirm your funding eligibility. And that process really is very straightforward. So the next slide outlines the onboarding process at a pretty high level. It's really very simple. This isn't a huge IT project or something that takes months and months. It's really very straightforward. Your first step would be to reach out to the agency and confirm your funding eligibility. And as I noted, that's a very straightforward process. If you're a Medicaid provider that is covering at least some Medicaid patients through this connection, then you would be eligible for funding. The next step is to sign the standard ENS agreement. We have that posted on our website. We can email a copy of it to you. And that's also very straightforward. Just have your legal and executive folks review that, come to us with any questions, and then sign. And then at that point, we have some onboarding documentation that we would provide to you. And then you would introduce us to your IT vendor, and we would work out with them the process to get you connected. And then you'd simply opt in to start sharing data. We'd perhaps arrange a training session with your team to make sure that folks are familiar with what the data looks like and what the data means and how they can use it. And then at that point, would you be opted in and exchanging data and reaping all of the benefits that data exchange can bring to your facility, to your referral partners, and obviously of most importance, to your patients and residents. So that's a very high level overview where we're trying to keep things brief here this morning, but that's how the network operates and how you can connect. So Pam, that was the material, the brief amount of material that we had prepared for the conversation this morning. So I'll turn it back over to you for any questions.
Okay, well, as Aaron said, if you have a question, you can type it into the question tab that's available in the webinar, or you can raise your hand and I can unmute you so that you can ask your question live. So we do want to take any questions that you may have. I do have a couple of questions that I see, Aaron. One of them is about funding. So after the first year of funding, what happens? So, you know, and Aaron, you can get a little bit more into cost if you want to. So we would pay for your initial connection to share data. And then after that connection, you would also be able to receive the data back, and that would be covered for the first year up to, I think, is it 50,000 patients?
It's, yeah, the max was intended for larger organizations. So I think all of the skilled nursing facilities in the state would have their whole volume covered. I don't think we have any concerns about any of them maxing out, given the upper limit on the funding. So I think we're good there.
Okay, and so then after that first year, there is a cost to subscribe to receive the data back.
That's right. So the fees that are charged to organizations to connect to the network and to be part of the data exchange, that's what keeps this whole thing afloat. And that's what funds the operations of the Florida HIE. After that first year, so that first year for Medicaid providers, zero cost. Your vendor fees are covered, fees from us are covered. You can connect and exchange data with your referral partners, receive data back from hospitals, reap all the benefits of that. There's no cost for 12 months, no commitment beyond that 12 months if there's if you're not seeing benefit to it. After that 12 months, should a skilled nursing facility organization opt to continue with the network, the cost from us is really steeply discounted for those who are sharing data. So it's 22 cents per patient per year for the time that you're watching for subsequent encounters. So if you want us to monitor for 60 days post-discharge for hospital encounters on your patients, then obviously that 22 cents would be prorated for the time that we're covering them. So since most facilities are at 120, 150 beds, you can see 22 cents per patient per year. This really doesn't come out to a lot in terms of fees for each organization. The minimum annual fee is $2,000, and that would probably be the amount that would apply. Since most facilities aren't going to come up near that minimum, but so very low rates after that initial 12 months for those who opt to continue.
And so this 1 year period, this initial period that's paid for, really is intended to allow skilled nursing facilities, allow providers to integrate it in with their workflow into their systems, see what the benefits are for your organization, and really make a determination on if this information is beneficial to organizations. Have we heard anything from any of the skilled nursing facilities on benefits?
Yes. So we have 120 skilled nursing facilities that are live and sharing data, and 85 of them, are set up to receive the data back, and they see a lot of benefit in it. It's still early days for most of those 85. They started receiving data fairly recently, but to know when their patients that they've recently discharged have shown back up at the hospital is of great benefit. And then to know on admit which ACOs are subscribed to this patient, which health systems have a relationship with this patient, which PCPs, is really beneficial because it cuts down on all of that manual effort to notify the ACO, every day about which of their patients have shown up, right? Doing a manual correlation of the list of ACO patients that have been provided to them, sending that over to them by fax or picking up the phone. terminally a password for an encrypted email. None of that has to happen anymore for them. So there's definite benefit to the basic data exchange that we're facilitating for them. So we're excited for them to be able to be connected, start seeing the benefits, and then start themselves advocating to their peers at other skilled nursing facilities about how this is helping their facilities and how this is helping their patients.
I've got a couple more questions in now. You mentioned in the presentation the benefit for the current pandemic that we have for COVID. And the question is, how would you know from the data that you received that a patient turned up positive for the coronavirus at a hospital? What is in the data that lets you know that information?
Right. So a patient who's discharged from a skilled nursing facility that's connected to the network, patient that's discharged and then shows up at the hospital. Several days later, a week later, folks can be asymptomatic for some time. So we can monitor patients post-discharge from your facility for a preset number of days. And we can work with the organization to determine that 30, 60 days, whatever is appropriate, and whatever they have appropriate consent for receiving that data. But it can be of great benefit to know not only that the patient has presented back at the hospital so that the facility can share any relevant clinical information that they have from the patient's time at their facility, and also work with the hospital if the patient chooses when they leave to be discharged back to that facility, but also that the skilled nursing facility can see the chief complaint when the patient shows up at the hospital. And those are symptoms that may be consistent with coronavirus, or upon discharge from the hospital, we do receive discharge diagnosis and multiple diagnoses from the admitting facilities. When the patient is discharged, that data does come to us. We can then route that back to the facility, and so they can know what the diagnosis code was when the patient was discharged, and that can really assist them with mitigation efforts at the facility to arrange for testing and treatment for other patients who may have come in contact with that patient or that resident, and also for staff members, so that they can take appropriate mitigation and quarantine efforts for their facility. We're seeing spread among post-acute facilities, and so obviously anything that we can do to help assist with data-driven mitigation of that would be terrific for facilities and obviously for the patients.
Thank you. That's very important right now. We have one final question, Aaron, and it's from somebody that says, for facilities that don't have an EHR system or only have part of their facility utilizing or transitioning to an EHR system, or they have a smaller EHR platform, can they participate in this with this service?
Yes, they can. It's a great question, especially since skilled nursing facilities and other post-acute providers weren't part of the EHR incentive program, meaningful use, promoting interoperability. They didn't get those incentive dollars to fund the adoption and use of EHR technology. And so not all of them have it. For those who have point-click care, Matrix Care, one of the other kind of large vendors in this space, obviously, those connections are something that we're pretty adept at and have been working to already connect in Florida. But for those who have a smaller EHR vendor or perhaps don't have an EHR at all, we can still work with them as long as their system is able to produce a list of admits and discharges and push that to us on an automated basis. That's something we can work with. And we can map that data and use that data not only to notify of encounters at your facilities, but also to alert you back when your patients show up at the hospital and to notify you of who else has those known relationships on the network with your patients. So yeah, we can definitely work with smaller EHRs or even other non-EHR IT systems. As long as they can produce that patient list, we can work with the facility and get them connected to the network so that they can benefit as well.
And Aaron, this might be a good time to share the prompt service that you guys offer as part of ENS if a subscriber would like to use that as a means to receiving information, receiving data on patients. And wouldn't that be something that could be used for folks that don't have an EHR system?
That's right. So we didn't focus too much on the details of how we'd send the data out or what's in the data. We kind of focused on how to get connected and the benefits. But it's a really great question. Yeah, there's a number of different options for how we can push data back out to skilled nursing facilities and to others who are interested in connecting. We can send it through an SFTP site where your system could then be set up with an automated process to go in and pull down that data. We can send it via direct. A number of skilled nursing facilities have opted for that, where we're pushing them essentially a secure email into their EHR, and they're able to manage the data that way. And then others have opted to use prompt, which stands for Proactive Management of Patient Transitions. It's essentially our web portal where you can log in and access the data online. We provide you a URL, username, and password, and you can go in and get the data that way. So it's all the same data, whether we're sending it via direct or prompt. There's different ways of accessing it and different interfaces, different sets of tools for managing the data.
Well, thank you, Erin. It looks like those are all of the questions that we have for today. Some really good questions, some really good interest in the ENS service for our skilled nursing facilities. And we really appreciate you taking the time to share this information, especially the information on how this could benefit these facilities during this pandemic. Really great information on how we can use this now and how we can use it in the future for skilled nursing facilities. I really appreciate you sharing this information, Erin.
Yeah, thanks for having me on this morning. And for folks on the line or people who are listening to this recording afterwards, if you have any questions about how to get connected, if you want to know who else is on the network, if the ACOs or hospitals that you engage with most frequently are already connected, or just want to understand the network a bit more in the process for joining, feel free to reach out through the information that's on the screen right now. We're happy to talk through all this with you.
Great, thank you. And I'd like to thank all of you for participating, being with us today, those that are here live and those that are listening to the recording. We look forward to working with you and helping you in making Florida healthier.